lifestyle choices such as regular physical activity and healthy dietary habits contribute to a longer average life expectancy, greater welfare, and reduced disease induced mortality. Good day, everyone. We are from Business 3C Group 2B. I am Divine Indico, and together with me is Johanna Fabillano, Jereme Fasiolan, Mark Ren Gamazon, and Jameela Rose Gonzaga, and we will be presenting a research paper entitled Level of Physical Activity and Dietary Habits of Nursing Students.
Consuming healthy foods and beverages, along with getting regular physical exercise, may help us reach and maintain a weight that suits us. However, college life has various circumstances. It is common to find them developing unhealthy dietary habits and not being able to engage in regular physical activity. Based on our research, there were limited studies on nursing students' dietary habit and physical activity, where most studies focusing on college students, university, or medical students. Our objectives: the study aimed to determine the nursing students' dietary habit and physical activity levels, similarly to promote a healthy weight and a healthy diet for nutritional behavior and a healthy weight appropriate for nursing students.
For our methodology, this study utilized a quantitative correlational research design to determine the nursing students' dietary habits, evaluate physical activity involvement and dietary habits throughout nursing year levels, and associate physical activity and dietary habits. The survey method in Google Form was utilized for easier distribution and retrieval of data. Next, for our participants, the participants were the nursing students in level 1 to level 4 with a total population of 959. Using Slovene sample size calculator, 282 out of 959 nursing students was chosen to be participants in the study, shown in Table 1 using probability, stratified random sampling, and in selecting a participants, we used simple random draw lots. For our instrument, a researcher-made questionnaire was utilized to collect the data from the participants. Part 1 of the questionnaire includes questions on the students' basic demographics such as sex, year level, BMI, and physical activity status. Part 2 of the questionnaire is the physical activity questionnaire based on the physical activity guidelines for Americans. Part 3 is the frequency and duration of physical activities. And lastly, Part 4 is the dietary questionnaire based on the dietary guidelines for Americans and adults' dietary habits. The validity test and reliability test indicates that the instrument is valid.
For the results and discussion, profile of nursing students. Female nursing students are in a greater number than male nursing students. For the profile year level 3 and level 4 have the which equates to 28.4% of the participants. For the level 2 is 23.4%, whereas level 1 is 19.9%. More than half of the nursing students have a normal BMI, while the remaining numbers are overweight, underweight, and obese. For the physical activity status, 69.1% of nursing students are physically active, meaning 30.1% are physically inactive. For the prevalent physical activity, the results showed that the prevalent physical activity of nursing students, according to their profile, sex, year level, BMI, and physical activity status, is the indicator I do stair climbing or walking in the school.
The table shows the frequency distribution and percentages of the frequency and duration of physical activity. Overall, the level of physical activity among nursing students meets the recommended physical activity guidelines of at least 30 minutes or more of moderate to intense physical activity in at least 3 days per week. The next table shows the dietary habits of nursing students based on their sex, year level, BMI, and physical activity status. Moreover, the verbal interpretation of the dietary habits of nursing students according to their profile is high. Predominantly, the results indicates that nursing students have healthy dietary habits as a whole and when grouped according to their profile variables. It is revealed that there is a weak positive significant relationship between dietary habits and physical activities. Therefore, the null hypothesis is rejected at 5% level of significance. The result indicates that the higher the physical activities, the higher the dietary habits of nursing students. In addition, there is also a negligible significant relationship between the dietary habits and frequency of the physical activities. Therefore, the null hypothesis is rejected at 5% level of significance.
This study leads to a conclusion that despite having a tight schedule, nursing students make time to do physical activities aside from going to school, as they try to make effort to be physically active while achieving their school requirements. They also portray a healthy routine while consuming the dietary requirements despite their classes starting early in the morning and consisting of continuous discussion. Nursing students are future healthcare providers, and they will play a key role in both modeling lifestyle and teaching healthy lifestyle choices to clients. Therefore, health promotion and maintenance among nursing students are important for them individually and professionally to positively influence others and to prevent illnesses. This ends our presentation, and Group 2B would like to express sincere gratitude to the following people who contributed their knowledge, supports, and efforts to finish the study. Doc OJ Jimenez and Ms. Sarah Jane Rosales are our early facilitators. Doc Ramon Chica and Doc Jocelyn Cadena are panel of evaluators. Sir Eduardo Bacalia, our statistician, our parents, and most of all, our Almighty God. We greatly appreciate the support and encouragement. That would be all. Thank you.